Sleep apnea is very close to my heart because my father actually passed away from a heart attack in his sleep. We knew about his sleep problems, and he was a loud snorer. And I felt that if he did that test, he's still alive, and I still miss him. Sleep apnea is a prevalent problem in our community, and there is a lot of people who are suffering from hypertension, diabetes, and developmental issues, depression, anxiety, and is all linked to sleep problem. It's a misconception that if you don't snore and you don't have an airway problem. I've seen several people who doesn't snore, means there is no air coming through at all certain time, and then you wake up with a big, like a soda pop sound. That is also sleep apnea in a way, and it's basically an obstructive sleep apnea and actually linked to acid reflux diseases, and it's linked to ADHD, especially in kids, bedwetting, and it's all directly linked to sleep problems. So my personal experience with asthma is that we have asthma in my family. A lot of people, they think that asthma is something that you can live with and don't know how it can improve, especially in young kids when they go through. And most of the asthma is related to, in kids, is related to allergies, and we blame them for just allergies, and actually is also caused by airway issues as well as acid reflux. When we can correct and identify these problems as early as 2 years, we can start treating them for airway problems and actually help them breathe better and develop their jaws better. And actually, overall development, it can also help. The program is called Healthy Start, and we just need to identify the stress factors like asthma, ADHD, anxiety, bedwetting, and sleep problems. All of those things can be related to a airway issue, and also can cause what we call as a teeth problem and jaw problems. Sleep medicine has been evolving for the last 20-30 years. Recently, we found that sleep medicine doctors need a lot of help from dentists actually helping them. And one of the major factors that we see is that early signs can be seen in their mouth, and we can identify those problems, and they're referring to our patients to the right kind of doctors to can help them better. The sleep studies test, one of the major things that has changed in the last 10-20 years is that we have a better solution. People have to do sleep tests to understand what kind of sleep problem they have. Most of the sleep problems are associated with airway problems, and we can identify some airway troubles, and we can see in the back of their throat. So when we identify them, we can do a couple of tests we call as a pharyngometer and rhinometer, and we can find out and if they have a collapsible, we call as a oropharynx, which is a back of the throat, and a tongue. And if they have a collapsible area, we could identify them and see what we could do, and to confirm that, we do what we call as a home sleep test. You can take a watch-looking device and you can take it home, and you can sleep in your own bed and do a sleep study, and that can be read by a sleep medicine doctor and find out and see what kind of problems you have. We can give you the information, and then we can talk to your own physician for a better care. This is a very simple test, and it's not very much invasive at all, and it's very easy to wear, and you can sleep in your own bed. And I personally tested myself. I felt very comfortable wearing it. I didn't even know I had this on, and I just woke up and I just put it back in my case, and I just bring it back to the office. As simple as that.